Um, and then with oncology, how do you help and impact your patients who are dealing with cancer?
A million different ways. It's been really interesting getting more training in oncology. Like again, in PT school, just like with pelvic health, like we had maybe like an hour lecture, a couple hour lecture about oncology, and the main thing that people get out of PT school is cancer is a red flag, right? And so now we're treating cancer survivors. So it was kind of like a mind-bending experience when I was a new PT, like getting in this population. Um, but I think the biggest misconception about cancer survivors, people going through cancer treatment, is that they're fragile, and they're not. They are strong, they're resilient, they can do anything. There might be some restrictions with what to do. But a lot of things that we'll work on are like balance, especially if they've had chemotherapy that causes neuropathy in their hands and feet. We can work on range of motion, we can work on strength, deconditioning. If they have radiation fibrosis in there, so I'm working with I was working with a gentleman earlier, and he had radiation to his jaw. And since then, he's had a really limited amount of motion that he can actually open his jaw because of that radiation fibrosis. So we can work on that to help improve the range of the jaw movement. We can work on scar tissue. We can work on sexual dysfunction. So there's a lot of different things that we can do within oncology PT. And then because I have that additional training with pelvic health, then, if I have, for example, a breast cancer survivor who's on hormone therapy that completely depletes their estrogen, that can lead to sexual dysfunction, vaginal dryness, and pain. And so we'll get referrals to work with people on that, which is pretty cool. A lot of people don't think of breast cancer survivor and sexual dysfunction and pelvic health. But that's a very underserved area within oncology survivors is the sexual health component. And there's, studies that show that providers aren't comfortable talking about it. And so if the provider's not comfortable talking about it, the patient's not comfortable talking about it, but it's an issue, right?
The
Like
conversation never gets had.
it never even gets started, right? They're embarrassed to talk about it. It's taboo to talk about. And sexual health, I mean, it's an activity of daily living. It's an ADL, just like toileting and grooming and, getting out of bed. And if this is part of someone's ADLs, as part of their identity, it's part of their relationships, I mean, that can have a huge impact on survivorship for these people. So there's a lot of different things that we can work on in oncology. There's some PTs that specialize in pediatric oncology, which is a whole other story. I'm not creative enough to work in peds. But, even within oncology, there's, these even more subspecialties to get into.
Yeah.